with Dr. Benita Zahn.
As vaccination rates against COVID begin to taper off, the Delta variant of COVID-19, well, that's increasing, and it's a more easily transmissible variant. So what does this hold for us at a time when basically everything's been lifted, all the constraints here in New York and California? Dr. David Holtgrave, the Dean of the School of Public Health at the University at Albany, recently penned an op-ed piece on this. He joins me to discuss it. Great to see you. As always, you have been a wonderful voice and educator for us pretty much from the start of the COVID pandemic. You've got some real concerns, though, going forward about the Delta variant, which had been known as the India variant before. Let's just get everybody on page. So good to see you, and let's jump into it, Dr. Holtgrave.
Great to see you, Dr. Zahn. Thank you for having me again. I really appreciate it. You're right about the Delta variant. So the Delta variant seems to be more transmissible even than the Alpha variant, which was one that was a concern before that. There seems to be some data indicating from the UK that the Delta variant also seems to lead to increases in hospitalization. And a really important property of Delta is that some of the two-dose vaccines that we've now come to be familiar with, one dose, for instance, of the Pfizer vaccine in a UK study seemed to indicate that the Delta variant was about 33% effective against symptomatic illness after one dose, but 88%, thankfully, after two doses. And so this property that the Delta variant seems to be well controlled by being fully vaccinated, by having two doses, but not so well after just one dose. That's really important because being fully vaccinated is really key with Delta.
So what is your specific concern then? As you know, yes, the numbers of vaccinations have dipped, but if you've got one, the odds are you are going back for the second one. Two doses seem to be effective. The research I've read early on, and please jump in because you know more than I, is that it still seems to be reducing the risk for death and serious illness, as the vaccines have shown for the other variants. So why the ongoing concern as you look down the road, particularly to the fall, the cold weather months?
Sure, absolutely. So I think there's a few concerns here with Delta. The first is that we've come to now hear about national goals being phrased in the form of, say, by the 4th of July, that there should be at least 70% of persons who get at least one shot of their COVID vaccine. And I think it's really important as we go forward with Delta to think about reframing those goals as the percent of persons who are fully vaccinated. And even though that may seem like a subtle difference, the percent of people who've had one shot versus the percent of people who are fully vaccinated, it's really key with Delta because we've got to make sure that you get that second shot and move forward. Also, I think it's really key because we're all now very familiar with CDC's graphics, their infographics about what can fully vaccinated persons do versus unvaccinated persons. When is it safe to be without a mask and so on? And that's been widely discussed. But if you read all of the fine print, you do see that CDC makes a distinction about persons who are partially vaccinated. But some of the summary materials, some of those infographics really say, what can you do if you're fully vaccinated versus unvaccinated? And with Delta, if you're partially vaccinated, you're in that in-between period, it's really important that you keep up your protections with masks, with social distancing, as if you were unvaccinated for that period of time. So I really think it's important now to talk about persons who are fully vaccinated versus persons who are either unvaccinated or partially vaccinated. And if you're unvaccinated or partially vaccinated, really important to keep up the mask, social distancing until you achieve that state of being fully vaccinated.
But let me ask, with the governor in New York lifting basically all the mandates, and you've got this large pool of people who are partially vaccinated, Delta is here, we know it will continue to spread. Paint me the picture you see and the concern you have.
Yes, well, I think we, with celebrations like we've seen in New York and elsewhere recently, I think it's important to say that those are marking interim milestones, but that we still really have some important work to do, especially with Delta coming along. And so we want to be mindful of all that we've achieved in New York and elsewhere, and to appreciate that. But that's an interim milestone. That's not all the way at the finish line, unfortunately, for COVID, and especially now with Delta. So I think that we need to make sure that we don't stop here. We can pause and appreciate the milestone, but we've got to keep up our efforts on increasing vaccination status among people, especially getting people fully vaccinated. If people aren't fully vaccinated, we are even partially vaccinated, we've got to keep up thinking about mask use and social distancing for a little while longer. And this is an important issue because, as you mentioned, this variant was first identified in India. Now it's in over 70 different countries. Here in the US, the federal government divides the country into 10 public health regions. Delta's in all of the regions in the US, and now accounts for about 10% of the genetically sequenced samples that they have. So around 10% of cases are Delta, and it seems to be doubling about every 10 days to 2 weeks. So this is going to be a threat for a while.
And I'm fully vaccinated, and yet there are places where I go where I'm still wearing a mask. Am I over the top, or is that being appropriately precautious?
I think that's absolutely just fine. And I'm in a similar situation, Dr. Zahn. Fully vaccinated after 2 doses. Very much appreciate the excellent vaccines we have access to and the protection that being fully vaccinated gives me. But I'll still make decisions like that. So for instance, if I'm going to be outside among people that I know are fully vaccinated, I may not wear a mask. If I'm going to be inside, but I don't know if everybody's vaccinated or not, I technically don't have to wear a mask by CDC's guidance, but I feel a little more comfortable for a little time. And I think it's important for all of us to say, we need to give each other a little space to make those decisions too. It's important not to stigmatize mask using or pressuring people, don't wear your mask. I think in CDC's guidance, it said if you're fully vaccinated, you don't have to wear a mask, but it doesn't say you must remove your mask. And so we're all going to make a little bit different kind of decisions after we're fully vaccinated about when we feel comfortable in what settings of finally removing our masks. So I'm approaching in a very similar way to what you are, Benita.
Yeah, and I know that the program I'm doing after this one with you, we're looking at long haulers and some diseases and illnesses. I don't even want to call it diseases, but some symptoms that continue that we haven't seen in a very long time. So again, it's food for thought. Dr. Holtgrave, I'm going to reserve the right to rebook you down the road because I know this conversation is far from over. Thank you so very much for joining us today, Dr. David Holtgrave, the Dean at the School of Public Health, the University of Albany. Thank you. Thank you. And we'll see you next time.